This is huge, with some caveats.
Today I'm pleased to announce historic reforms to dramatically accelerate access to new medical research and treatments based on psychedelic drugs. In many cases, these experimental treatments have shown life-changing potential for those suffering from severe mental illness and depression, including our cherished veterans. And I got a call from a number of people, including the great Joe Rogan, and he said we have to do something about this. And the suicide epidemic among veterans is a national tragedy. Since 9/11, we've lost over 21 times more veteran lives to suicide than on the battlefield. The executive order I'm signing directs the FDA to expedite their review of certain psychedelics already designated as breakthrough therapy drugs. These treatments are currently in the advanced stages of clinical trials to ensure that they're both safe and effective for the American patients. This order will clear away unnecessary bureaucratic hurdles, improve data sharing among the FDA and the Department of Veterans Affairs, and facilitate fast rescheduling of any psychedelic drugs that become FDA approved. In 2024 study from Stanford University, 30 special operation veterans with traumatic brain injuries underwent, it's called Ibogaine Treatment. Ibogaine. Remember the name. Is that pronounced relatively properly, would you say? Yes. I don't want to get it wrong. Ibogaine, because it's so important, and experienced an 80 to 90% reduction in symptoms of depression and anxiety within 1 month. Can I have some, please? I'll take some.
This is amazing. And as someone who's been very closely following the psychedelic science world, I'm super excited that they're now a lot closer to being approved. But the focus on Ibogaine during this whole press conference was a bit misleading. But to get to that, let's review the 5 things that this order actually did. 1, the FDA will give national priority vouchers to qualifying psychedelics that have already received breakthrough therapy designation. Basically a VIP pass that shortens FDA approval times from over 10 months to down to maybe only a few weeks. And 3 will be given next week. But Ibogaine will not be one of them, because it doesn't have breakthrough designation yet due to safety concerns. The most likely candidates are versions of psilocybin and LSD, which we'll get to. 2, the FDA shall facilitate and establish a pathway for eligible patients to access psychedelic drugs, including Ibogaine compounds, under the Right to Try Act, which is the 2018 law that lets very sick patients who have run out of other options get access to try certain experimental drugs. But including Ibogaine compounds here is pretty controversial, because the law says that the only eligible drugs are the ones for which a phase 1 trial has been completed. That's an official safety trial, which Ibogaine doesn't have yet because of some concerns about cardiotoxicity, heart health risks, which we'll cover. 3, the HHS will set aside $50 million towards matching state psychedelic research programs, like Texas's recent program for researching Ibogaine. But this funding can also apply to other psychedelic research. 4, the Department of Veterans Affairs, the HHS, and the FDA need to start working together on psychedelic trials to increase trial participation and to share data, which is underratedly a big deal. But again, this prioritizes drugs with breakthrough therapy designation. 5, the Attorney General has to act fast to review any drug that has completed phase 3 trials, to bump it down from Schedule 1. Right now, legally, LSD and psilocybin sit in the same legal place as heroin. So, the problem with Ibogaine is that it's been shown to interfere with the heart in a way that has led to multiple reported deaths and emergencies, both within clinical trials and outside of the context of them, but reported in the literature. We might be able to get around this with proper reporting, monitoring, and maybe co-administration of magnesium, like this trial did. But we need to figure that out before Ibogaine can really benefit from this order. I'll do a full video on safety soon. But right now, the biggest winner here is probably psilocybin, the main prodrug found in magic mushrooms. There's a synthetic formulation called COMP360 that finished phase 3 trials back in February for treatment-resistant depression, and is currently the furthest along towards approval of any psychedelic. We're also in the middle of phase 3 trials for CYB003, which is a modified version of psilocin, which is the actual psychedelic compound that psilocybin turns into in your body. And there's also a phase 3 trial underway for MM120, which is a synthetic version of LSD used to treat generalized anxiety disorder. This will be good for MDMA and DMT as well, but they've got a bit more work to do still. There's so much to cover here, and I want to show you guys some of the actual data around the effectiveness of these compounds and how they work, but let me know what you want to cover first.